Denise Welch returned from a sunny Caribbean holiday to be rushed to hospital after spending 24 hours in emergency care. Denise Welch has spoken out about her recent diagnosis, following a 24-hour hospital ordeal. The much-loved Loose Women panelist had only just returned from an idyllic Caribbean vacation when she found herself in a dire medical emergency almost 2 weeks ago. In hospital, she was put on a drip and diagnosed with 2 intertwined conditions that have potentially serious complications. On the show, the 66-year-old explained, "I got back from a lovely holiday in the Caribbean last Saturday. All bronze, looking forward to coming on here last week and showing off my suntan and I'm back and all this. And I got rushed into hospital on the Saturday with acute peritonitis, a perforated diverticulitis," she revealed. "So, I've been in hospital on a drip for a week. Excuse me. Anyway, they didn't have to do surgery, they got it with antibiotics, thank you. As my mother said, take me to the knacker's yard." According to the NHS, acute peritonitis is an infection of the inner lining of the stomach, which is often influenced by numerous factors including a burst stomach ulcer, appendix, or complications of diverticulitis. A perforated diverticulum, as in Denise's case, refers to a tear in the bowel wall that can be fatal if left untreated. In rare cases, an infected diverticulum, pouch in your colon, can split, spreading the infection into the lining of your abdomen, perforation, NHS Inform explains. An infection of the lining of the abdomen is known as peritonitis. Peritonitis can be life-threatening, and requires immediate treatment with antibiotics. Surgery may also be required to drain any pus that has built up, and it may be necessary to perform a colostomy. Typical symptoms of peritonitis include persistent stomach pain, high fever, rapid heartbeat, and unusual changes to your urination patterns. Some patients also experience a loss of appetite, nausea, and a swollen stomach. Immediate medical attention is crucial for anyone exhibiting these symptoms, as the risk of severe complications like sepsis increases if the infection spreads. If you have regular kidney dialysis, your doctor might discuss a different way of doing it until the peritonitis has been treated. It can be difficult to digest food if you have peritonitis. A feeding tube might be passed into your stomach through your nose or placed inside your stomach using keyhole surgery. If a feeding tube cannot be used, liquid nutrients can be given directly into one of your veins. Although Denise assured she was well cared for by medics, she took a moment to reveal another particularly negative part of her hospital experience. "I was rushed into hospital. I was all right, but I was in A&E for 24 hours, she said. "Now, they were looking after me and there was no bed. They kept saying, 'There's no bed for you.' They wanted me on the surgical ward. They said, 'There's no bed, Therese, no bed, Therese, no bed.' Somebody had spotted me and phoned the press, and I was in a bed in 15 minutes. However, the celebrity expressed her relief at recovering, even managing to find humor in the situation. "I'm meeting and believe you me, what's going on down there, I'm a loose woman, believe me," she quipped.